no doubt that AI has been taking the world by storm, and now it's finding itself in the mental health space. With 1.6 million Canadians youth that struggle with their mental health, what do we know about AI use in mental health? How do youth find themselves in being in the mental health field? So today we are going to cover this next slide, please. We're going to be learning and tackling different issues based on what AI is and how it came to be about versus what we think is going to happen in the future with mental health support and personal stories about us. So now I'm going to pass it on to Josh to talk about what AI is.
We can just move on to the next. Perfect.
Yeah.
Awesome. Did you want to give a brief overview of the MDSC quickly at all?
Yeah, for sure. So, hi everyone. My name is Laetitia. I'm one of the co-chairs of the Mood Disorder Society of Canada's National Youth Advisory Council. So the Mood Disorder Society of Canada, or MDSC, it's evolved to become one of Canada's best connected mental health and non-government organizations, with a demonstrated track record for forging and maintaining meaningful and sustained partnerships with the public, private, and nonprofit sectors throughout Canada. The National Youth Advisory Council of MDSC, it works to not only advise some of the council's initiatives, but it also works to assist with continued public education and advocacy, resource creation, research, and more. So I know that we already kind of got some brief introductions, but really quickly, I'm Laetitia Satam. I use she, her pronouns, and I am co-chair of the Mood Disorder Society of Canada's National Youth Advisory Council.
And I'm Joshua Bell, he, him, and I'm also a member of the National Youth Advisory Council here today.
And I'm Eden. I use she, her pronouns, and I help with the high school subcommittee and core council.
And then before we went any further in this presentation, we felt that it was important to kind of outline what we thought artificial intelligence is, to have that kind of working definition for this presentation. And we define that based upon AI being the ability of any digital computer or computer-controlled robot, device, or anything like that to perform tasks that intelligent beings would be able to, such as humans and ourselves. We also defined a more specific form of AI as well, artificial general intelligence, AGI, also known as strong AI. And this is really the AI that a lot of people have really been talking about in recent months and in recent years, and that AI that's really able to duplicate what humans are doing. So these will be our working definitions throughout this presentation today.
So now we're just gonna currently discuss, how is AI being used right now? We know it's really been in the news, being used throughout a lot of different organizations in a lot of different ways. But I'll actually pass it over to Eden to talk about how MDSC itself has been using AI.
So MDSC has partnered with what is called Mira, and it's a virtual AI assistant that is an organization providing information relating to mental health services for professionals, youth, adolescents, and all categories where they hope to provide a safe space for anyone in a crisis. But even though there are sometimes some glitches, MDSC and Mira are hoping to resolve those issues.
And coming down to another AI that we've seen being used right now is Suno. So Suno is a 24/7 chatbot basically that's been specifically designed for mental health and mental health aid, especially when it comes to if your person's feeling isolated or lonely, and that someone's able to message the robot, and it's programmed to respond in ways that show compassion and ways that are able to help you work through your problems or any issues like that. Kids Help Phone, if you guys want to tackle that one again.
Yeah, so Kids Help Phone, as kind of was introduced earlier, it's the largest provider of mental health services in Canada. So it has a very large reach for youth from coast to coast to coast across Canada. And Kids Help Phone, being this large organization, they recently announced a partnership with the Vector Institute, which is to beginning for them to start using AI use. So while AI would not be used to provide actual support to young people in a chatbot sort of way, they're implementing natural language processing, and that's going to be able to adapt to learn how young people speak. And then this data that the AI is, collecting, this data can be used to build better programs for young people while still ensuring that that human and frontline contact with a real life person is still there. Um, and then in terms of like how AI is being used on a broader scale outside of individual organizations, we've been seeing some clinical implementations, and we'll be discussing that later on in our presentation. But, there's been some studies showing that when you use AI for diagnoses, for example, it can actually be a lot more objective than a psychiatrist who's following the DSM-5. And then, AI is being used by everyday people. I'm sure a lot of folks here have heard of like ChatGTP, even Grammarly, a lot of ways that we're using it as students. It's really being integrated by everyday people. And studies have even found that people are turning to AI systems that were not designed for mental health specifically, like ChatGTP, which really is demonstrating that there is a demand for easily accessible mental health services. Virtual mental health therapists or chatbots are being utilized by many different people as a quick and easy way to access, mental health support. And this is kind of happening regardless whether the AI has been trained to specifically support mental health related issues. So there definitely is a demand. And I'll pass it over to Eden to discuss how AI is going to evolve.
So at the same time, studies are using and know that AI is being used in a person's everyday life, and especially when they are feeling down. It is helpful, but at the same time, it doesn't give accurate information. And when a person doesn't have anyone to turn to, they tend to use AI. So studies have showed this in the many upcoming years.
Awesome. Yeah. So thank you so much for sharing, kind of how AI, how it has the potential to grow in the mental health field. We know that right now it's super novel and it's really up and coming. So over at MDSC, we did a brief lit review and we were just trying to explore some gaps in the literature, what we were finding for AI use in the mental health field. So while we found that AI use in the mental health field is a novel research topic, there actually have been like a substantial amount of studies evaluating the success for AI services like chatbots, in assessing high risks, crisis situations, and being used to connect youth with resources. Some of the ways that, what Eden was mentioning with Myra and MDSC, I know that's happening through the University of Alberta. It's like building a database, and then AI can be used to filter out all these resources to young people and really get them what they need in a way that might be more efficient than, like a person who has to walk you through all those resources. However, there has been a lack of data that we found in the literature regarding youth perspectives of AI use in mental health and how youth and younger segments of the population will be affected. So while youth may have varying definitions of success, this was a really big gap that the youth perspectives and what youth attitudes are towards AI use in mental health has not really been evaluated on a larger scale yet, especially as we see more and more organizations beginning
I
to
have to find out
implement.
a way to change the view.
Lena, can you turn your mic? Thank you.
No worries. Yeah, just to kind of continue onto that train of thought. So young people are one of the largest populations that are accessing AI mental health services. So it is crucial that these services are implemented in collaboration with the youth that they will serve. This can be done by engaging youth as research partners, working with youth groups during the creation and implementation of AI in mental health services, and knowledge translation that is easily accessible to all communities to eliminate any feelings of unease due to the unknown. So, not all studies reported engaging youth in the research process, aside from kind of studying them as research participants. So we would really advocate that the research process kind of has to be restructured and really focus on patient-oriented research, youth research partners, and really getting youth involved into the nitty-gritty of the research process itself. And then finally, one of the last gaps we found, kind of building on some of those previous slides, was that the training for AI use in mental health and support specific use. So like how does this method of using an AI increase or decrease someone's ability to discuss their mental health? And what are the issues that may arise with the AI if the code stops working as programmed? Of course, when it comes to AI, that is a lot of people's biggest concern. There have been instances in the US. I know I've read a few news articles where the AI started actually kind of presenting really harmful information. I know that with some of these like machine learning processes, sometimes they can begin to learn about, they start having their own biases, and that can be really harmful for some communities. So really ensuring that AI use is ethical and equitable. And then, there has been a gap in how AI technology can support clinical care in a way that is still human centered. I think what we kind of saw attitudes in the literature was that while patients may not be super comfortable getting their diagnoses from AI, there is still a lot of potential for it to be implemented in clinical care. But kind of building on those gaps, I'll pass it over to Josh to kind of discuss some of those youth perspectives of AI use in mental health, which is really the focus of this presentation.
Yeah, and as you kind of just mentioned, that youth are one of the largest segments of the population. We're constantly at the forefront of changes and are one of the generations that are using AI the most out of everyone. Pardon me. And kind of building upon that too, youth already have an involvement when it comes to mental health creation, mental health policy creation, and input into some of the stuff that we see happening in the world of mental health and clinical care. In that, speaking from all of our own experiences here today, in that youth involvement in the mental health field, such as what we're doing with MDSC, volunteering, going out, providing information to people, education in that, providing some support, such as through volunteering with Kids Help Phone, advocating for policy change to ensure safeguards for such technology like AI use in mental health, and that when it becomes more prevalent in our system. So all of us are kind of active and seeing those changes on the front lines right now in more minor ways. Over the coming years, and that we expect an uptake in AI use, both on the clinical front, but also in general daily lives of people as they seek out more supportive resources that might fit better to their schedule or what they're really looking for in that, whether that be an in-person psychologist or use of AI and other technical means. We also know that there's a feeling of uneasiness, though, when it comes to this change, especially with youth in that, especially a lack of knowledge surrounding AI in the mental health field, but then also a lack of knowledge about what AI is actually capable of when it comes to supporting someone's mental health and well-being. When it comes to accessing services such as AI in mental health, and that we've seen that there's a social stigma that also continues to persist in that, especially as AI is still new, especially in the world of mental health and that. So people who seek out AI services and that how are they going to be affected and treated, especially in comparison to those who actually seek out in-person services through psychologists or therapists or other people like that. There's also been a really high interest from youth about how is this going to better people's mental health and well-being in that? Are the services that are being provided through AI going to be better, or in some cases equivalent to those as to if you were to seek out an in-person psychologist or other mental health professional in that. So there's really an interest right now in what's really going to happen with this and that. Is this a step forward that we can continue on, or will we have to take a step back and reevaluate before we're able to continue any further with it and that? Speaking on that note as well, about increasing services and that, when it comes to accessing support and that, we know that there's barriers that continue to persist with the care that we're seeing right now, whether it be in-person services, clinical care, and stuff like that. So how are changes when it comes to AI's use in mental health and service providing going to really change those barriers? Are they going to alleviate those barriers come the future so that more people can have access to the mental health services that they need through actually trained AI that's specific in mental health and well-being to support their mental health and well-being in their communities? I'm going to pass it back to our co-chair right now.
Yeah, awesome. So that was kind of, the conclusion of what we had to share today. Just to like really briefly summarize, we do understand that AI use is super novel. We know that so many organizations are beginning to implement it in all the different ways that we outlined. And we really are just advocating that the youth perspective is going to be qualitatively and quantitatively evaluated through the research process, through organization implementation. But I think, all of us, we are really excited to see how AI is going to continue to shape the mental health landscape. So yeah, thank you all so very much for attending our presentation, and we'd love to open the floor to any questions if the audience has any.
Thank you so much for this presentation. We learned a lot. I'm pretty sure it's the case for everybody here. Yeah, I see some people turning on their cameras. My colleagues at the center. So I'm just gonna go and hand the floor to anybody who has a question to any of the three presenters. So go ahead. And we have people from France actually, so we're pretty happy about that. And I told them, and I tell the whole crowd that if you have questions in French, I can translate them. So we have a lot of time, so don't be shy.
Yeah, I can kick us off. Thanks for having this presentation. I hope you can still hear me all right. I'm just curious. We're building a startup in this space, and we're making it particularly for students because that's where we've realized the need really is for mental health. How do you suggest we best engage students to like not only download a new app on their phone, which is already like people don't like doing that, but also engage in their mental health? Like, is AI novel enough to be like interesting enough for people to download and try it, or do you think we need to do more stuff?
I think that's such an interesting question, and I'm like so happy that you're really looking to incorporate youth and get that like youth perspective in there. I feel like from what I've seen like with my personal experiences with like these organizations and on campuses, the biggest drawback for a lot of students is just the uncertainty. So I think when you're promoting these services, transparency really is key. I think being extremely clear on how it's being used. Is the AI chatbot, is it a chatbot that's like directly providing the advice and there's not any like human there to filter things out? Is it being used for like resource implementation? I think privacy and like specifically saying like how students' privacy is going to be protected is a really large concern for a large bit of the student population. And then I think, since you said you're a startup, I'm not sure how far you are in that process, but I think if you can work with youth throughout the process of like creating this AI chatbot and working with them throughout and really promoting that, then when you want to get those users, I don't think downloading the app is like the biggest barrier to students accessing AI. I think it's just, has it been like promoted? Do they feel confident that it's been vetted by other students, that it's been, really created with youth in mind? And then, you know, um, yeah, so that's a bit of my train of my thought. But yeah, just really making sure that it's youth focused, youth centered, and that those perspectives have been considered. Maybe I'll let Josh or Eden jump into with some of their own experience and expertise.
Yeah, I just kind of want to jump in here too, and I agree with what you kind of said there in that too. When it comes to marketing or using AI, especially if it's specific for mental health and that for students and that, what I've seen through my own experiences and that where I am right now in my post-secondary is that privacy and security when it comes to it. So students want to know that the AI is not going to be taking and storing any information that they're telling it. They want to know that it's actually giving them real advice back, the same as like a psychologist might or a therapist or something like that. So ensuring that you have those precautions in place before it's implemented and even during when it's implemented and being marketed.
That's a great idea. I think we've touched on a lot of things, but I'd love to develop with like folks like you in mind. I'm just curious, is there a way to get more youth involved in the development of like a project or an app like this?
Absolutely. I know. So we're all from the Mood Disorder Society of Canada. So we have a national advisory council. We can share over our contact information, emails, and everything for that as well. And then if there's ever any other organizations that you're like looking to model after or that work with youth directly, I always recommend reaching out to some of them. A lot of organizations, especially in the mental health space, do have like youth advisory councils. I know Kids Help Phone has one. A lot of them do. So definitely doing that outreach, even when you're doing outreach towards like university students, they have like wellness centers, those counselors. There's a lot of great clubs, support groups there too that I would definitely encourage you to.
Great.
We're
Great.
not
I'll hit you guys up after this then. Thank you so much.
we're not presenting ourselves, but we are the hosts of the presentation, and we also have youth council. So feel free to reach out. We have a teens youth council, well, teens council and youth that are above 18, but definitely reach out to
Got
the
it.
Society of Canada. I don't want to poach any of their assignments, no opportunities. Thank you. Anyone else? I think we have our own Lena.
Can you hear me? Okay, great. Excellent. Thank you everyone for this nice presentation. Sorry I disrupted by coming late, but it was excellent. So we have a few people around the table. I will start the question, then maybe other questions as well. One of the thoughts that I had is I have very limited experience as a user of any mental health apps. So this is a very ignorant question in many ways. But one thing that strikes me is there is a difference between using AI or anything that is like digital technological assistance for wellness and using it for helping somebody who is going through a mental health challenge itself. Most of the digital apps that we see right now are like wellness focused. There's very limited actual health or recovery or rehabilitation focus. Now, as young people who are users as well as advisors in this field, what do you actually think as the difference? Is this something that we need to think more deeply, that you cannot simply take a wellness app and apply it to health? I can think of one example which kind of worries me. There was this thing called Tessa, a chatbot, which was introduced by the Eating Disorder Network some time ago. And when it was introduced, there was no much concerns about how this is going to be for the process that was intended. But increasingly, the young people who interacted with this chatbot started feeling, started getting psychodynamic reaction to it, started getting lots of uncomfortable experiences from this chatbot, which was not really something that the makers of it initially thought about. So my question is really, do we need to be careful about not taking wellness apps and putting them into the mental health space? Do you have any thoughts on this? How should you go about it if you're trying to apply AI to mental health?
Absolutely. I feel like you've brought up so many valid concerns that we've seen stem through our organizations and through the literature. Um, I think the biggest thing is like how when you look into the research of like how these AI apps are like being coded through like machine learning or natural learning processes, it's really important that you're coding it in a way that the AI itself is not gaining any like biases, because that's a huge concern. I know that like one study that I'm involved with is looking at the use of AI for like primary healthcare physicians and ensuring that like social detriments of health for patients are being evaluated. But when you're kind of feeding your AI all of this information, you have to make sure that it's not going to start developing its own biases, that it's then going to start spitting out to those youth people, young people who may be using these apps. So do I think that we should be, taking these wellness apps that may have also been built more, because there are a lot of apps out there that are using AI more for, like monetary reasons opposed to youth support. I don't think it's the same copy and paste. I don't think that would be like appropriate. So I think there needs to be like a lot of like guidelines, and I'll let Josh speak on the policy side of it as well, because he's a lot more well versed in that than I am. But all the policy work surrounding like what data is allowed to be used, implemented, collected, and then how are we going to ensure that it's only going to be used in a very helpful way. So I also know at Kids Help Phone, like we're partnering with AI companies, and we are, we have a lot of data from young people, but we're not building a chatbot, and we're not building something that is going to be communicating with young people. And that is a concern. Sometimes we get phone calls, we get texts, and young people are asking, am I talking to a real person right now? So I think, on the note of the transparency that we were talking earlier, like letting young people know that you're still talking to a real person. This is still a person who has expertise in their field and they're a trained professional. But just the AI use, it can help you triage like who is in a crisis situation right now and who needs to be, who needs to answer that phone call first. Some of the RIF studies that we were looking at too, it was looking at, sometimes I'm a nutrition major. Sometimes if you're an overweight patient, you can be depressed, you can have anxiety. But if you're overweight, the doctor might just be like, well, maybe if you lost weight, you would feel better. Kind of ignoring like all these neurochemical imbalances and everything. So then maybe AI could be used as a more objective evaluator for some of these diagnoses, opposed to a psychiatrist who might have their own biases and, follows the DSM-5 in their own ways. So I think there is so many intricate ways to use AI. I think at the end of the day, it still needs to be like human focused, human centered care. And I think you can't just be copy and pasting from a wellness app into these like really intricate and really ethical situations. But I will definitely pass it over to Josh, because I know there's so much policy work that surrounds how AI is being used too.
Yeah, and I know like we've continued to touch upon this theme today of transparency and like accountability, especially when it comes to AI use and how it's being used. Making sure that the people that are using it, even if it's like a mental health app or a chatbot on a website or something like that, how is people's data being stored? Like, how is it responding to things? How is it trained in that? Where did it learn from? And things like that. I just want to touch upon the example that you kind of brought up there with that chatbot where it seemed to have backfired on that. So in my view, a major part of it before any chatbot or wellness service and that is enrolled, you want to ensure that you've actually tested it first and that making sure that it's actually set up properly so that it doesn't respond in ways like we saw like that, where it was giving out extremely harmful information to youth that were accessing the service and just people in general on that. So making sure that you have an operation strategy set up for the AI or the wellness app or something like that before it's actually outrolled and people access it in that. I also want to make a clarification as well, because I think that there's a difference between health services and then wellness apps in that too. So health services in that obviously like you have your doctors, your psychiatrists and things like that. More the wellness and AI services in that I think are a temporary solution in that. We don't want people relying on those services for long periods of time, especially if it is like an AI service chatbot on a website or something like that. We want that to be kind of a temporary fix or a temporary access of a resource until they're able to kind of get in full time to a psychiatrist or to a clinical care or something like that as well. We don't want them relying on it for too long.
Thank you.
I have a question too, actually. So I was wondering, you mentioned before, I think you're right that people might not want to be like talking about all their problems to like just some AI chatbot or something like that. But I was wondering if you think that those new models that they can serve as a bridge to maybe answer any concerns or questions people might have before they access care to sort of like, well, not, well, I guess convince them that this care can actually help them. Have you seen that maybe already existing, some kind of chat that you can use, for example, before you book a, I don't know, some meeting with a psychologist, you could answer a few questions and they could reassure you that, for example, the psychologist is not going to force you to do one thing or another. Have you seen anything like that, and do you think that's something that could be useful for youth specifically?
Personally, I myself have seen like services and websites where I know BetterHelp, for example, does like a questionnaire or something to match the person to the right professional. I know even though it's a chat box, it's still like somewhat helpful and useful.
But was it using like some form of AI, or was it just like just a questionnaire that you fill out?
It was AI based.
I think that the more information that the person has before they seek out the resource in that, whether it's like an AI form, like was just mentioned, or an actual AI in that, but so any information that they have before they actually access the service in that is beneficial, whether it be about how the service is used, any successes with it in the past in that, having that information right in front of you before you access the service is beneficial, makes you feel more comfortable on that, lets you know a little bit more about its abilities and what it's capable of. Hopefully relaxing you a little bit so you're not as worried about your data and other privacy issues and that with it. But yeah.
I've been interacting with a person in the chat who wanted to share his perspective, or his or her. So he or she is retired director of a disability organization, and the concern with AI is that youth will look at it instead of real advisors with professional degrees. It is an important concern. Young people can often be easily swayed, especially people with mental health issues or major concerns, to professional parents. And lastly, that is, I'm sorry, that is it. So maybe any of you three want to comment, or just, I think just a comment from that person.
Yeah, and I kind of want to, so like I said before too, and kind of the answer from the gentleman before, in that we don't want these AI services or chatbots to kind of replace any in-person psychiatrists or mental health or clinical care in that. I think that we need to find a way to market them or let the public know that, hey, these services are there for a short-term solution, or if you're feeling down or something like that in a set period of time, but to really still continue to access those like that clinical care, those in-person psychiatrists and things like that. The younger generation, my generation, and youth really in general, tend to lean on technology a lot more than previous generations and that. So I think that we're going to have a little bit of a challenge there, ensuring that we don't see a drawback from those in-person services and clinical services and that. But I think it is possible to be done with the right messaging and things like that.
Thanks.
Can I ask one more question? This is an interesting discussion. Josh, from what you just mentioned, I think there is really a case to make for a youth-driven summary of what are the acceptable use cases for AI in youth mental health. Because I'll give you an example. When we interact with, let's say, if we interact with Bell to buy a cell phone, the first interaction, almost always guaranteed now, is with the AI system. When I do that, when I'm trying to buy something, I'm actually okay to interact with the AI system to get the questions answered and then be directed. But when I have a repair or a problem in my cell phone, and when I want it to be fixed, when I go online and the AI is asking me a question, I really lose it. I lose the cool. And I guess this kind of, use cases where acceptability differs for AI to be the first point of call is likely present in youth mental health as well, correct? I wonder if there is a democratic exercise that could be done among youth in the mood disorder services, in your group, also with some of our councils as well, to really come up with what are the top 10 use cases where first interaction with AI is acceptable, where human in the loop is completely essential, and there will be no trust without human in the loop, things like that. I wonder if you've already thought about it, or is there a gap here that you think that we could all fill together?
No, and I think that is a gap too, in that we're kind of seeing that, especially when it comes to what you just kind of mentioned in that, because I know I haven't seen any firm case study in that too yet about such situations. Pardon me. Again, AI is still new, especially in the forms that we're seeing it now, though. But I think you made a really good case about having acceptable uses in terms and stuff like that for AI, especially when it comes to health-related use with AI and wellness. That's a sensitive topic for a lot of people in that, but also one that has a great impact on everyone depending on the outcomes of it.
Exactly. No, you have a question here?
Yes, so I want to know that how we can actually increase the motivation for end users, especially patients, to accept the results, especially when the results saying that, okay, they might suffer from schizophrenia or maybe suffer from depression. So they might say that, oh, that's AI and I don't accept it and I don't care. So how we can actually motivate them and say that, yeah, is it the result? Just go to the next step, contact with the psychiatric or your family doctor, do further investigation about your mental situation. How we can do that from your perspective?
Yeah, no, absolutely. And I think like some of the trends through the literature has seen that it's older adults who kind of tend to be a little bit more untrustworthy of AI, and they may not trust those results. But I really like that you're thinking about like, okay, so you have this diagnosis through AI, because right now with the Canadian healthcare system, a lot of people, they're unable to get those diagnoses. They're unable to, even get their foot in the door to the psychiatrist to get it. So right there's a solution of AI kind of bridging a burden that we're seeing in Canada, and with these really long wait times and everything within the healthcare system. So I think if it's someone who has, actively gone out of their way, they really wanted to see a psychiatrist, they really needed to get access to a primary care provider, and they got this diagnosis through AI, it might be what they were looking for. But for someone who wasn't expecting this diagnosis, I think, of course, we're not using AI to replace psychiatrists or nurse practitioners or doctors. It's not the replacement for these people. It's just in a way to support them. So I think the follow-up next step is like, okay, if you really don't trust these AI results, of course you're entitled to that emotion and you still have your right to healthcare and everything as that. So I think the next follow-up step would of course be, if you want to see a skilled real life human being professional, whether that's a psychiatrist or family doctor, and maybe having them run the test and run them and get their their expertise involved too. I also feel like right now there's all these feelings of uncertainty around AI use just because it's so novel. Maybe 10, 15, 20 years down the line, we'll kind of look at it like, why were people scared about it? And it might kind of seem like a second nature thing, but of course, when things are new and up and coming, there's always going to be that hesitancy. So I think one of the best ways is just to keep including those like family doctors and these are the people too in the research who are involved. I know with the few studies that I've seen, they are working directly with psychiatrists and making sure that the data and everything that's being implemented is through people who have like real life experience in the field as well. So while maybe our AI networks aren't as developed yet to, include the vast amount of experience that a lot of our physicians do, in the future it might get there. And I think just having the transparency and letting the patient kind of decide, do they want to they want a diagnosis re-evaluated by someone else? Are they willing to accept it and kind of go on to the next steps of their treatment? I think making sure that it's patient-centered would really be the focus.
That's a good question. If it's a good time. I just had a quick question, to see, sorry, I didn't see the beginning of your presentation, so maybe you already mentioned it, but are you involved with AI in youth mental health, like sort of in the support side instead of like directly interacting with patients? Because I've heard of AI in other fields of healthcare working for, like, for example, filling out the physician's like progress notes or clinical visit notes in order to reduce like the time that takes. So yeah, are you involved at all in sort of helping AI be introduced in like the supportive side of healthcare rather than with patients directly?
I think like for myself and maybe the other folks as well, I've definitely been more experienced with it in the support side. Kind of seeing how it's directly supporting youth mental health through like the use of chatbots, or kind of like with what Kids Help Phone is doing. We're not using AI to provide care to young people, but we're using AI in a way that is kind of collecting the data for us. So then it kind of helps us build better programs. So we've been using like natural learning processes, and that kind of looks at how are you speaking, how can we tailor the language of some of our resource creation and implementation to be more youth focused. So kind of more in that support role. Josh, Eden, I don't know how you guys have been using mental health or AI using your mental health fields.
Yeah, and I
Yeah,
feel like no, go ahead.
oh, okay. Yeah, I would say we mainly just use it for research based in education, but to help with like the social fields and stuff like that.
I was just going to say, so a lot of our presentation kind of focused on more of the service providing in that of it, instead of on the back end of how it could be used like in the office type space of healthcare and that in those administrative offices and that. I do think that there's equal case for it to be used in situations like that as well, kind of with the same question though of how is it going to protect the patient's data, because there's a lot more data and healthcare access that it would have to patient records and stuff like that to be able to fill out some of those paperwork and some of that other stuff in that. Although I do I do think AI would be helpful in those back end situations, especially right now with the shortage of like family doctors are saying how they're having to spend upwards of like 70-80% of their time just filling out paperwork most of the time instead of actually assisting people and helping people with their needs.
I was just wondering because I feel like since there's been points mentioned about people's resistance or sort of natural hesitation towards talking to a chatbots or artificial intelligence, like maybe, I mean, I'm sure people have considered, and I was just wondering if you had like lifting the burden of tasks from physicians in another way so that they can spend their time like triaging and doing and communicating with patients. Yeah, so like AI is taking something else away so that then physicians can put that time into like their time with their patients. But
I think that's like an amazing initiative and way to look at it. I know that one study that I've been involved with, they're kind of looking at how AI can be used to screen patients specifically for their social detriments of health, and kind of being able to evaluate like if different backgrounds that they may be coming from, and kind of ensuring that even before a family physician is going to be like seeing this patient, that they're kind of like trained and like well versed in like their different parts of their background that might impact how they interpret healthcare, the type of resources and access that they'll need. So while that's maybe not like doing the paperwork side, I think it's just kind of allowing for like more holistic health practices. So that's a different way that I've also been seeing it being used in the clinical spaces for sure. That's really novel.
well, thank you.
Are you guys involved with the Mira chatbot? If you are, could you share some of your experience with us?
Yeah, so mainly like it's more of a collab experience we've had, but personally I help them time to time with their research and reporting glitches and bugs.
So Mira is active, huh? It's one of these initial pioneered chatbots from the MDSC, right?
Yeah.
So some of you might not know. You look at it. It's called MIRA, Mira. The Mood Disorder Society of Canada really championed this chatbot. I don't know how much it's used in Quebec. Do you have any data how much the province is using it? Any of you?
No, like I'll have to double check, but I'll put the link for it in the chat if that's helpful.
Thank you.
I know I don't have any data right in front of me at all, but we can check with the MDSC and some of our internal records on that and get back to you. I believe we have our contact email here with the center that we can forward to you.
Thank you.
Yeah, and the Mira chatbot too, even outside of kind of that with the youth, I know that the software has also been used to support healthcare workers and their families. I think the support side for the healthcare workers has mostly been piloted in Alberta and Nova Scotia, I believe. So kind of like the Mira software, it's kind of been featuring like four major elements: the Mira chatbot, the resource portal, the data set, and the interface. So the chatbot, which is kind of, I think, what most people picture what they're engaging with, it's the primary purpose of that would be to provide strategic resources for users responding to the custom needs that they share. So they kind of like, they might type in like, okay, like I need resources for someone with an eating disorder, with anxiety. So like then when you provide kind of that unique information, the chatbot will kind of filter it through like two main tasks. One being like intent detection and then like entity extraction. So like the intent detection side of that would be like where the chatbot is identifying the needs of the user, you know, kind of based on the chat experience. Do they need resources to support a loved one? Are they a healthcare worker that might be facing burnout, or are they a person who's looking for the resources for themselves? The data behind that's been amazing. I think the accuracy rate was like over 99%. So it was phenomenal. And then the second aspect of that, the entity extraction, this is like where the chatbot is going to recognize important keywords from a sentence. The accuracy rate of that has been like a little bit lower, and I think that's what we're kind of developing. The accuracy rate was still above 95%, so not low by any means, but sometimes too, I think that's what we're seeing a lot with like kids help phones, virtual assistants as well, is that sometimes even when a young person is like engaging through a text, sometimes the way that they're using language and like there are certain words that maybe like as like an adult that doesn't, I don't know, depending on how comfortable you are with like youth slang always changing and all these words. How can you pick up on something that may not seem as a keyword to like a crisis responder, but maybe the chatbot recognizes, okay, when this term's been used, this is when this resource can be used, or this might be escalated. So I think the work that Mira has been doing through that has been really fascinating to see, and kind of like how we're tracking youth trends as they're evolving.
Totally. Yeah. I wanted to say, tell me about it when you said slang. Yeah, it evolves every week. It's difficult for some of us to keep track of this.
So
Thank
I
you.
will jump in and congratulate you for one special thing. I think 90% of the presenters and all across the world, all across presentations, never have enough time for the crowd to ask questions. And I think you had a lot of time, and I think a lot of people here are happy that you answered their questions. I want to thank you for presenting. I want to thank everybody in the crowd to have been dynamic and interactive. We will be posting this conference on YouTube shortly. Obviously, we'll tell you by email the youth council. And again, thank you very much. And we will see each other shortly. Thank you.